Welcome back to Expert Perspectives on Obesity Management, presented by Cedars-Sinai Medical Center at Diabetes Series Live. You are tuned into the live session, Obesity, Weight Loss, and Long-Term Health, with Dr. Xavier P. Sounier. My name is Tracy Mitchell, and I'll be moderating today's session. Before we get started, I'd like to remind you that today's session is a live interactive program that allows me to take questions in real time throughout this presentation. I encourage you to send your questions anytime by typing them in the box located at the lower left-hand side of your screen. I'd now like to introduce our presenter, Dr. Xavier P. Sounier, Professor of Medicine at Columbia University. In addition, he is Chief of the Division of Endocrinology, Diabetes, and Nutrition at St. Luke's and Roosevelt Hospitals. Welcome, Dr. P. Sounier.
Thank you, Tracy. It's nice to be here. My topic this afternoon is talking about obesity, weight loss, and long-term health. And I'd like to start with this slide, which shows you the disease prevalence attributable to obesity. Obesity leads to a lot of comorbid conditions, which are quite serious and affect people's quality of life enormously, as well as their mortality rate. We're talking primarily about type 2 diabetes, about different kinds of cancers like endometrial cancer, colon cancer, and breast cancer, about gallbladder disease, osteoarthritis, hypertension, coronary heart disease, and sleep apnea. If one can impact obesity, one impacts all of these diseases and makes the diseases much less serious, or prevents them if one can really impact the obesity strongly enough. So obesity is an early and effective therapeutic target for prevention of type 2 diabetes, of hypertension, and of coronary heart disease. Obesity, as you see on this slide, leads to a number of risk factors: hypertension, dyslipidemia, hyperglycemia, inflammation, and coagulation. And all of these impact the presence and severity of diabetes, coronary heart disease, cancer, and other diseases. So it is important to intervene. It's important for physicians to try to figure out where they want to begin intervening. Obviously, if one starts when one is obese, one is intervening with a lot more people than if one waits until those persons get hyperglycemia, dyslipidemia, and inflammation, and go on to get diabetes, heart disease, and hypertension. But starting early is a way that a physician can prevent disease rather than have to treat it later on. And we know that modest weight loss improves health. Moderate weight loss of 5 to 10% of baseline weight will improve type 2 diabetes, lower glucose, lower hemoglobin A1C, improve both systolic and diastolic hypertension, and improve abnormal lipids. It will lower triglycerides, lower LDL cholesterol, and raise HDL cholesterol, all of which obviously impact prevention of disease and also the severity of the disease. I'd like to start discussing type 2 diabetes. Obesity, as you can see from this slide, in both men and women, leads to a much greater risk for diabetes. On the horizontal line, you see the body mass index from 23 all the way to above 35. And on the vertical axes, you see the risk. And you can see the risk increases very steeply if one goes up above a BMI of 25 in both men and women. So the risk is greatly increased, and if one can lower the BMI, that is, lower the weight, one will lower the risk. We also know that the US population not only suffers from diabetes, which you see here from age 20 to age greater than 65 in the red and blue strips on this population curve, but also suffers from impaired glucose tolerance, which you see in yellow. An impaired glucose tolerance is essentially a risk factor which we now call prediabetes, which causes a much greater prevalence and incidence of diabetes. And you can see from this slide from 5 different studies in the United States showing you the percent of the people who have impaired glucose tolerance who develop diabetes per year. And you can see it anywhere between 4 and 10% and 8% of people who have diabetes, impaired glucose tolerance, develop diabetes. So it's a tremendous risk factors that one needs to impact to try to prevent the progression to the disease. We know that there's a relationship between insulin sensitivity and fasting plasma insulin. On the horizontal scale here, you have insulin sensitivity. On the right, on the vertical scale, you have fasting plasma insulin. As you move to the left on this slide, people are more insulin resistant. That is, their insulin sensitivity goes down. In order to maintain their glucose norms, they have to raise the plasma insulin. So people who have low insulin sensitivity, that is, people who are insulin resistant, have higher plasma insulin. And obesity leads to insulin resistance. Not only does general obesity lead to insulin resistance, but abdominal obesity leads also to insulin resistance. What you see here on the horizontal line is visceral adipose tissue volume, that is intra-abdominal fat. And on the vertical line, glucose disposal by people. And you can see that as you increase visceral adipose tissue volume, you decrease the ability of a person to dispose of glucose in their tissues. As a result, the glucose rises in the bloodstream and people become diabetic. So one wants to minimize the amount of visceral adipose tissue available, that is central fat, because central fat leads to diabetes. And you can see that here. This is individuals on the left, their blood sugar. On the right, their blood insulin. In the blue are normal people. In the red are obese people. And you can see to maintain glucose normal, which is a slide on the left, as they eat the breakfast, lunch, and dinner, they have to raise insulin a great deal more. And so they have higher fasting insulin, much higher, 5 to 6-fold greater insulin to dispose of their blood sugar. And as a result, they exhaust their beta cells, which make the insulin, and become diabetic. Short-term weight loss, and certainly long-term weight loss, improves insulin sensitivity. In the red, you see insulin glucose disposal before weight loss. In the blue, after weight loss. There is a great improvement in the ability of the body to use up glucose for energy. This is the effect of weight loss on people who already are diabetic and have elevated blood glucose. On the red bars is a control group with no weight loss. On the blue bars are people who have lost 4.7% mean weight loss. On the left is the fasting glucose, and you can see it went down. And on the right is the 2-hour post-load glucose, went down even more. So you have a big impact on blood sugar as you lower the weight in individuals. And you can see here that we're only talking here about a 5% drop, but a very significant impact on blood sugar. This shows you another study that shows you exactly the same thing with 10% weight loss. The yellow bars are a control group, non-obese group. On the left, you have glucose. On the right, you have insulin. The orange bar shows you the blood glucose and the blood insulin before weight loss. The blue bar shows after 12 months of weight loss, with a weight loss of 10% from baseline. And it is clear that the blue columns